Hey guys, I'm Dr. Dean, chiropractor.
And I'm John Aldrich. Welcome to ProFunction.
Today we're going to talk about foam rolling.
Hey John, how are you doing?
Hey Dean.
So John's foam rolling now using a typical like 36 inch foam roller. There are two types. There's a closed cell and an open cell. John's foam rolling on a closed cell, which I like because you can sanitize it. The open cell is more like foamy. So John, I know you like to foam roll, and you and I have spent some time talking about it in the past. Why do you like to foam roll?
Well, I feel like it's a good way to relieve some of the maybe muscle tightness or some knots you have in your muscle.
So show me where were you foam rolling? It was on your side of your leg?
Yeah, the bottom of my quad.
Okay. So feels a little better after you're done, right?
Generally I'd say yeah.
Yeah. So, okay, so just from your point of view, let's say you're like at the gym, you see other people who are foam rolling, and everybody's got this idea, their own idea about why they foam roll. So makes you feel better, but do you know why that works? Why does foam rolling work?
Well, I would think it's because you're relieving some of the pressure and tension on a tight muscle.
Okay, so
applying
show me,
pressure.
show the camera, show specifically, use one finger, and show me where you have there's a little pain or whatever's going on. Okay, so right
here.
there. Okay, so John's pointing to an area called the musculotendinous junction. So his quad, his vastus lateralis muscle belly is here, and then it starts to get smaller and smaller and turns into tendon right about here, and then that becomes part of the suprapatellar tendon, and then the patellar tendon kind of attaches down here on the front of the tibia, on that tibial tuberosity. So right about here it becomes very, very dense and thick, not like the muscle, which is pliable and soft. So that's a good place to foam roll. You would never want to foam roll the belly of a muscle because it's too soft and there's not really anything there to treat. So most of the problems are going to be at that point. So that's awesome. Do you know why foam rolling works?
Because you're applying pressure to a point where there's tightness and allowing it to be pinned down so that you can then go through movement at the joint.
Okay, so you've identified what you're calling tight. Now, of all of your choices, why are you picking this, a foam roll, rather than, let's say, getting a massage or going to the chiropractic doctor and having them do ART, for example, or myofascial release? So why do you choose to do this on your own?
I think the big thing is just because it's easy and it's accessible.
Right, so you do this while you're at the gym, or you bring your own foam roller. Okay, I see. And then when you're done, you feel somehow better, right? But are you knowing that that's better? Or is it possible you're making that worse?
Well, it's very possible I'm making it worse because I have no real way to measure.
Which we call assessment, right?
Right.
So in chiropractic, we use what's called the Visual Analog Scale, VAS. And the VAS is a subjective sensation, like you feel like when I started, I had pain about 7 out of 10, and now I feel pain like 3 out of 10. So that's subjective. You can't really measure that, but you feel
right.
that you feel that it's better. Okay, well that's good. And it's good to be able to treat yourself without the expense of going to a doctor. However, of all of your choices, this may not be the best one. You could actually be making this situation a little bit worse. So I have a really good question for you. How did you learn how to use this roller?
Well, I was taught by yourself.
Okay.
And
Right.
from visualizing other things or YouTube. And
Where do you think most people think they learned how to use the foam roller?
I'd say A would be from a trainer, or B would be just from looking at other people in a gym.
Right, and that's a disaster, right?
Mimicking.
Because you look at somebody over there doing this maybe something, you say, oh, I think I know what they're doing, I can't really tell, what are they doing, right? So you don't ever want to be in a gym and do mimicking, right? And a lot of what you and I are going to talk about in the future is about picking up bad habits from other people in the gym. Even if they think they know how it works, we don't want that, right? We want to be
Absolutely.
way more educated, which is why we have ProFunction to begin with.
Right.
Right? Okay, so that's great. So you're on that one spot, and that's a really key spot. That's actually an excellent spot, and it's probably because we've already discussed this, to actually use a foam roller. Foam roller is good for very few spots on the body. If you have tension or tightness in your body, depending on where it is and what it is, there probably are other techniques, but I would not be using this foam roller, for example, on your IT band or on your hamstrings. I would not be using it on your calf. Anywhere where there's a big soft belly of muscle tissue, even if it feels tight, because you have to remember, and we're going to look at this on the iPad,
Okay.
we're going to go into some detail. The foam roller isn't just putting pressure on a tendon. It's putting pressure on arteries, veins, nerves, which can be a big problem, right? Lymphatic drainage,
Absolutely.
right? And so you have to keep your mind open that when you're applying pressure onto your body, when you go to somebody like me, that's a chiropractor, I know the anatomy. I know what structures to avoid.
Right.
So these spots that we're going to talk about that are really good to treat with the foam roller are absent of nerves, absence of arteries, absent of lymphatics. So I want to make sure we
And
don't
if I'm
crush
just on
those.
here flopping around, I don't know what I'm smashing.
You don't know what you're smashing, right? And we've discussed this before,
Right.
that it could create an inflammatory response, which there's a whole cascade of chemistry that happens that creates metalloproteinases and other chemistry that's actually going to decompose or reutilize proteins in that area. It's going to rob proteins to help that inflammatory response occur. And now you have, of course, muscle guarding at the joint, you have joint dysfunction
Right.
and such like that. And
Need
that's
more dysfunction.
right. And so we don't want that. We want, if you're going to foam roll, we want you, our goal in Pro Function is to have you understand how it works and how to make it work the best, the quickest, least amount of time, most efficiency.
Most functional.
Right, so let's go to the iPad. Let me show you what I'm talking about the specific anatomy.
Great.
So let's look at the iPad and see what kind of anatomy we're dealing with this foam rolling. So I have the whole body here, muscles, bones, and tendons and ligaments. And let's just zoom in on, let's say this is your knee where you are working. There you go. Here's the knee. And so you can see the red area, of course, that's where most of the muscle is going to be. And then the white area, in this example, this is going to be tendon here. And then so if I just touch on that, it's going to show us that's vastus lateralis. So that's one of the muscles that you were trying to treat. You were saying that there was a little problem there. And then this is the IT band, which is here. And of course, there's no red in the IT band because it's all connective tissue, right? So my point about this is this a safe place to foam roll? And so we want to be avoiding things like nerves. So let me add the nerves. And you'll see the major nerves here. Sciatic nerve is coming down here, posterior tibial nerve. Here's a nerve here, common fibular nerve that comes around the outside, right? So there are no real nerves in this area for a good reason. It's on the outside of the knee, and they would get injured. So your body protects by putting all the nerves in the back of the knee. And then let's add here arteries and veins. So most of the arteries are deep in the body, so we don't have to worry about those. But veins are typically on the outside. So let's zoom out and look and see. Oh, well, they're not. This area here we're talking about treating. This area here is pretty clear. So this would be a great place to do some foam rolling right across where those muscles touch or connect onto the bones. So let's look at a place that would be bad for foam rolling. Let's come around the back of the leg and then look at that. So everybody wants to roll their calves, but look at all of these major veins and these really big nerves. So you would potentially be crushing those, and that would create that inflammatory response that we're trying to avoid. And if we come down here and say, okay, well, I want to somehow loosen up my calf is tight. Well, look, here's a clear area right down here on that Achilles tendon that you could foam roll or do foam roll pressure points. That would be really great. So there's an example of don't foam roll. And if we come around the front and come back to the place you were foam rolling, say, oh, this is a great place. That would be a great place to foam roll right through there. So we saw on the iPad this area that John wanted to treat. We already cleared it. It doesn't have any arteries, veins, nerves, anything that we're worried about, any other structures that are going to get crushed and create that, we talked about, inflammatory response. So on your left knee where you were foam rolling before, let's go back there. So just show them what you're trying to affect, what you're trying to treat. This area here, so you said there's a tight spot there, and so that's a good spot. So let's put that right on top of the roller. Now remember, the roller's round and they call it a foam roller, but we're not really going to use it for rolling. We're going to use it for pin and stretch, which is way more effective. So John's on that spot, he's using his body weight. Now to be effective, he's got to stretch that structure where he's pinned. So he's going to bend his knee and he's going to pull through that structure. So his tendon in the front is getting longer, 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 longer under the pressure of the foam roller and his body weight. And he's going to do that several times, back and forth, to tolerance. Okay, so it might be a little uncomfortable. If he has numbness, tingling in the leg or in the foot, or he feels like an electric feeling, then you, of course you would stop because you're not on the target spot. Okay,
Right.
So let's move on to using the foam roller in a different way. So have a seat here and face out, and let's use now the foam roller for articulating the spine. So keep your hips down on the mat, and then go ahead and touch your shoulders like this, and keep your hips down, and then drop back and open up your chest right. So what we're doing here is we're opening up the chest, and we're also opening up the spine, so he's gapping his spine. So if he had any tight spots in his spine or a little achy back, right, and I'm going to roll the foam roller away, and he's going to be changing the position of the articulation. So you can come all the way up here, and I can do it even in the low back. So notice the foam roller is not moving. He's not rolling up and down on his spine. That's all muscle. You don't want to just smash and crush the muscles in the spine. Good, so there's a lot of tissue in that lower spine that you can treat. So this is a really great one for people who have mid-back pain. So notice the foam roller's on an angle. He's going to keep his hips pinned, and he's going to rotate that lumbar thoracic joint complex, right? So there's a place where the lumbars are rigid, but the thoracics of the rib cage rotate, and so he's just giving that specific spot a chance to be treated with that pin the lumbars and rotate the chest. Good, come on up. Great, and then one more, John, go ahead and put your hips right there, sit right on the edge of the roller and lay back. And now John's going to use this for a chest opener. Good, so just reach out to the side like this and put your fingernails on the floor and open up your chest. Now straighten your legs all the way out. Good, keep your toes up and balance a little bit. And now what John's doing is he's opening up his pectoralis, his pec minor, his anterior delts. Because the foam roller is round, he's using that round crescent shape to open up his front of his body left to right. Okay, great, and then come on up. That's good. Okay, John, it's time for the Pro Function takeaway. You ready?
What did we learn today, Dean?
All right, so today we talked about foam rolling, and we talked about that the foam roller is a roller, but we're not actually going to roll with it, right? We talked about not rolling it up and down our quads, up and down the hamstrings, up and down the calf, the back, right? So although it's round, what we're going to do is we're going to use the round edges to pin an area that we want to treat that's at that musculotendinous junction between the muscle belly and the tendon, not the belly, but the tendon area near a joint. We're going to pin it, and then we're going to bend that joint up and down, and we're going to do what's called pin and stretch.
Right.
And that's how we're going to treat. So there are going to be areas that are going to be in the muscle belly, but somebody else is going to have to treat that. That's not good for the foam roller. So the areas that we did like, do you remember where they are?
Well, for one, we had this one at the bottom of the quad.
Yep.
Near the knee. What are some other good areas though that we didn't touch on?
Okay, so the Achilles tendon we talked about in the back, right down here, right? You can actually even go under the kneecap is a good spot too. The SI joint is a good one in the back of the lower back. The glute border is a good one behind the joint capsule of the hip, making sure you're not on that sciatic nerve.
Okay.
That's a good one.
We showed some of the stretches.
Right, and then we also showed how you could use the foam roller as a way to bend backwards and kind of open up your spine, open up your chest. You could even use it to open up like one joint at a time.
Or as the surfboard.
Right, and I'm sure we'll demonstrate that soon.
But what are some areas that we want to definitely avoid? I know we
Okay.
talked about
Definitely wherever there are a lot of nerves. So you don't want to be on the lats because that's highly innervated. You don't want to be on the front of the chest, the front of the shoulder. You don't want to try to get to your psoas. It's not really possible, but I see people trying to do that. That's not a good place for a foam roller. And then I want to make a point that although we see other people doing things and we think maybe there's a therapeutic value, maybe there's not, I looked into the research on this myofascial release, which is the technique of using the foam roller. And there's not a lot of really conclusive studies that say doing this can even really change you. Is it going to change the anatomy?
no positive outcome.
No, there is a positive outcome, and the patients did feel better sometimes, but
Okay.
we don't understand the mechanism of it, right?
Got
So
it.
as a treatment, if you're going to use the foam roller to treat it, you might feel better, but are you making the problem better? We don't really know that yet.
Got it.
Great, so we hope you enjoyed the show, and we look forward to seeing you again. Thanks.
And remember, if you see it in the gym, that doesn't mean it's legit.
Exactly.
Thanks, guys.